Welcome to Your Healthcare Matters. I'm your host, Jenna Sims, and I've worked in healthcare for over a decade. And like many of us, I'm really concerned about the deterioration of our healthcare system. On this podcast, we interview patients, healthcare professionals, and advocates to provide unique perspectives and helpful tips for navigating our failing healthcare system. My goal is to inform, connect, and inspire listeners to take your health into your own hands. Dr. Jennifer Lush initially wanted to pursue a surgical career at UBC, but she discovered her passion for building long-term relationships with patients, which led her to family medicine. She has practiced in various rural and urban settings across BC, Alberta, and Australia, offering services such as locum work, obstetrics, and emergency care. Since 2016, Dr. Lush has run her own practice in Victoria while also teaching medical students and residents. Disheartened by the resignation of esteemed colleagues and practice closures, she became an advocate for ensuring access to family doctors, believing it's essential to addressing the healthcare crisis. Dr. Lush, thank you so much for making time for us today and letting us take over your clinic.
Of course, I'm happy to be here, Jenna. Thanks for coming.
I'm curious to hear what attracted you to family medicine in the first place.
Well, it really was the opportunity to have a relationship with my patients. Other areas of medicine were intellectually stimulating and interesting, but I realized that I wanted to know my patients better than just seeing them perhaps once in consultation or once in follow-up. I really wanted to have the opportunity to get to know them over time, to walk with them through all of life's journeys, from cradle to grave. It's the sort of the cliche, but it's really true. We get to take care of babies, adults, seniors. We get to see people in their good times and their bad times, and we really come to care for our patients and their healthcare outcomes. And that is what makes family medicine the most rewarding field of medicine for me and hopefully for lots of others that we can recruit to this field.
Right. It's a much more special relationship than just seeing someone once or twice.
Yeah, and you really get to know their healthcare issues in a much more fulsome way, which allows you to deliver better healthcare for them.
And what would you say is your favorite thing about running your own practice?
Well, I like the autonomy. I like being able to have some say over what my practice is going to look like, the staff that I might be working with, to have some flexibility in hours and so forth. That's been really beneficial from a family and work-life balance perspective. But my favorite thing is the patients, without question. I really enjoy my work colleagues. I'm privileged to work with a great group of family physicians. I have wonderful office staff, so that brings me joy every day. But none of us would be here if it wasn't for the patients. And, I also really enjoy the variety in my practice. So never knowing what's going to be waiting for me to handle behind the next exam room door. So it's always interesting. It's always changing. It always represents a challenge. And the challenge is always worthwhile because I'm doing it for patients that I care about and who I know and have gotten to know over time.
And what is it like to work as a family physician today? What's something that our listeners may not realize that family physicians go through?
Well, family medicine is as rewarding as always, but unfortunately, the rewards are being offset increasingly by burnout and administrative burdens. I've been practicing for just over 20 years, and there's far more administrative work, paperwork, hours spent charting now than there was when I started practice. And that really detracts from, the delivering care to patients, which is why we all go into medicine in the first place. They have done studies that show that the average family physician is spending 30 to 40% of their time on administrative work. And that needs to change because we could care for so many more patients. We could offer better access to the patients we have, be more available to them if we weren't spending so much of our time on unnecessary administrative work.
Right. And do you see some solutions for addressing those challenges?
There's definitely solutions out there. We need to work to streamline and reduce forms. Our electronic medical record systems are very inefficient, and there's many systems all across the province which don't talk to each other. So if we could have a streamlined, efficient system where specialists and primary care physicians could all share data, hospital and community physicians could all share data, and we wouldn't spend so much time reinventing the wheel or tracking down results that have been done elsewhere. So those would be two very achievable solutions that would make a significant difference.
So you mentioned electronic record keeping. What other role do you feel like technology could serve in the future for family medicine?
Certainly, with our increasing need for healthcare as our population ages and fewer healthcare providers to go around, I think it's important that we leverage technology to make our healthcare providers more efficient. Physicians having access to secure and effective electronic medical records would make a difference. The electronic medical record systems in hospitals need to be efficient and talk to the community systems. We can also use new technologies. There's increasing use of things like scribes, so using our computers to help generate our notes, so that I spend less time charting in my evenings and maybe can see one or two more patients. So there's some new and exciting technologies that are coming along, and I think it behooves us to look at how we can use them in a safe way, still keeping patient information confidential and safe, but so that we extend the physicians that we have and allow them to spend more time caring for patients and less time in front of their computer.
Hmm. So, speaking of things that are adjusting our system, can you describe the longitudinal family physician payment model and how it has impacted doctors in BC?
Sure. Well, that was a new payment model that came out in 2022, largely as the result of advocacy efforts on the part of physician groups and the public through BC Healthcare Matters and similar agencies, lobbying for change. And it's been an encouraging step, but it's only one step towards resolving this issue. Family doctors in BC have felt encouraged by the LFP payment model. It allows us to deliver better quality care because now we are being compensated if we spend more time with a patient who needs it, which is appropriate. So it incentivizes good quality care. It pays us for those 30 to 40% of hours that are spent doing administrative work, whereas before that was all done without pay. And it has allowed, I think, those physicians who are already in practice to feel that it's more sustainable and they can carry on practicing rather than facing closing their practice. What it has not done is generated huge numbers of new family physicians in the province. It has not eliminated administrative burden. So there's still changes that need to be made to address the family physician shortage that we have. It was a promising first step, but much more needs to be done.
Can you describe the longitudinal family physician payment model, or the LFP, and how it's impacted doctors in BC?
Sure. The LFP model was introduced in 2022 largely as the result of advocacy efforts on the parts of physician organizations and the public, primarily in the form of BC Healthcare Matters. And that model has been an encouragement to physicians already in practice. It has allowed them to keep the doors open and to keep their practices running. We no longer have to decide whether we can spend more time with a patient and whether that's going to compromise our ability to pay our bills each month. And so it is, it's been wonderful to see. It's been a good first step in the right direction, but it's only one step. It hasn't brought substantial numbers of new family physicians to the province. It hasn't ensured that everybody in BC now has a family physician. So much more work needs to be done. We need to continue to work to reduce administrative burdens. We need to make the family physicians we have more efficient at delivering care through things like team-based care. So we need to train and recruit more family physicians to the province. So much more work is yet to be done, but it was a good first step, and all family physicians have been very grateful that was introduced.
It's encouraging to hear that there have been systemic changes recently in the past couple of years. To one of your points, what do you feel like we could do to better attract healthcare workers to BC?
We need to make the practice of family medicine more sustainable and the administrative burden less onerous. Young physicians who are considering their career options are being turned off by the amount of administrative work. 30 to 40% of your hours doing admin work is very off-putting when we went into medicine because we want to practice clinical care. So if we could lessen the administrative burden, I think that would help us attract more people into family medicine. If we could have more efficient electronic medical record systems, if we could build effective care teams that allow us to develop and deliver the kind of care that we want to give to our patients in an efficient and timely fashion, I think that would be attractive. We need to ensure that, compensations are appropriate. We live in a province, we all do, where there's a high cost of living. But the people often don't realize that family physicians don't have paid time off. We don't get sick pay. We don't have a pension plan. And the ability to save for our retirement in a province like BC is being eaten away at by the high cost of living. So we need to make sure that compensation is appropriate. So there's many things that could be done to attract more people into the field of family medicine. We can address inefficiencies in the healthcare system, lack of resources. There's a lot of moral distress as a family physician. When we are trained to provide a certain level of care, we have practice guidelines that tell us how we should be able to deliver care, the timelines in which we should be investigating, somebody for a possible cancer. And when our hands are tied and we can't get the CT for our patients, or we can't get them to see a surgeon in a timely fashion, that really contributes to burnout as well. So addressing the healthcare system crisis as a whole will make primary care more sustainable, and primary care as the foundation of that healthcare system needs to be supported to thrive, or we're going to continue to struggle with the healthcare system.
It definitely sounds like there's a lot of different obstacles facing doctors today. I'm curious, what are your thoughts on foreign trained physicians?
Well, that's a tricky one. I have a bit of an ethical issue. I don't think our solution to our healthcare crisis should be to pilfer foreign trained physicians from other countries that also need their medical professionals. But for the foreign trained physicians who want to come to BC for other reasons, maybe family reasons or who knows why, if we have foreign trained physicians who are coming here already, we need to streamline their ability to practice medicine. BC, unfortunately, is known as one of the most difficult provinces in which to get licensed. And so I think we need to change that. Yes, we need to ensure our foreign trained physicians are meeting the same practice standards as any Canadian trained physician, but many of them do. And they want to practice here, but they're unable to get licensed here. There were 4 family physicians a couple of years ago who'd lived in Vancouver for years, had been trying to get licensed here for years, finally gave up, and now Saskatchewan has 4 family physicians that BC does not. And it's those sorts of administrative and bureaucratic barriers to welcoming foreign trained physicians that could need to be corrected. Another thing that we need to correct are people who go overseas to do their medical training because of a lack of training positions here in Canada. They go to Ireland or Australia, for example, to do their medical school. They're having troubles coming back and doing their residency training or getting licensed here. And that needs to be fixed because they're Canadians who want to practice in Canada, and we have barriers in the way of them practicing. So we need to change that.
Right. So we definitely want to welcome them back home with their new
open
degrees.
Arms. Yes.
Yeah. I'm curious about your thoughts on team-based care.
Team-based care is proven to deliver excellent patient outcomes when it is appropriate team-based care, when it has all members of the team working together to the top of their scope to deliver the best possible care for patients. The trouble is too often team-based care is misrepresented. In response to the healthcare crisis, for example, we are seeing stopgap measures like having pharmacists prescribe for patients. And that's not team-based care. That's trying to replace one member of a team with another member of the team. What we need is the entire team. We need physicians, we need nurse practitioners, we need pharmacists, we need social workers, we need nurses. We need all the members of the care team working together at the top of their scope to deliver excellent care to British Columbians, which is what patients all deserve.
So more of a collaborative approach then.
Certainly, yes. And when we have limited numbers of family physicians, we can extend those family physicians. We can allow them to care for more patients by giving them a team to work with. I'm really privileged in my practice here. I have a nurse in my practice. I have access to a social worker and a mental health consultant and a pharmacist, but I'm part of a pilot model, and that's not available across the province to all family physicians. So I think we need to offer all family physicians who are caring for patients in BC the opportunity to be part of an effective team, so that all patients across BC have equal access to care and have the same excellent outcomes.
Right. And do you have any concerns about implementing team-based care? Like, how could we more smoothly roll this out across the province?
Well, there's many different ways of doing it. We know that certainly the health authority is trying to build some teams, but there are other physicians in practice who would like to build teams within their own clinics, but under the current LFP model, we can't afford to. So we can't build our own teams. So family physicians and communities need to be supported to build the teams that will work for them. So sometimes that might be like a health authority funded community health center. Sometimes it might be a nonprofit funding it. Or we could look at, offering family physicians appropriate funding so we can build our own teams and we can hire nurses, especially like the rural physicians, for example. They might need to be given more autonomy to build a team, because they're not near a big health authority run clinic. We do need family physicians leading as the leaders in primary care. Family physicians should be consulted and involved in the development of teams rather than having bureaucrats and administrators deciding what team-based care looks like. I think family physicians, allied healthcare professionals, and communities should be the ones determining what a comprehensive team-based care model looks like.
Right. So having all the stakeholders at the table, having discussions and planning together.
Absolutely.
Yeah, I think that's a great plan. Dr. Lush, what challenges do you foresee us facing over the next several years in primary care?
Well, of course, there's the issue that we are already facing, which is we don't have nearly enough family physicians, and there's already 1 million or more people without a family physician. But some challenges that we haven't talked about or that maybe people haven't thought about, a very real one is the fact that our family physician population is aging along with the general population. And in fact, 30 to 40% of family physicians in BC have said that they may retire or reduce their practice in the next 3 to 5 years.
That's significant considering we're already in such a big deficit.
Exactly. So, we need to there's some urgency to finding these solutions. We can't just keep talking about the problems and the possible solutions. We need to implement them sooner rather than later. We need to make sure, if we're going to have fewer family physicians to go around, that we are making the ones we have as efficient as possible by perhaps building effective team-based care. We need to make sure that family medicine is sustainable so that those who are currently in practice might reconsider closing their practice and stay in practice a bit longer. And we need to be recruiting and offering more family medicine training spots in our residency programs. Because, if we think we have a crisis now, if we don't start implementing these solutions, it may get worse over time. Another thing that people don't think about necessarily, but is very real as well, is BC is seen as a wonderful place to live. And we do offer a home to people who move from other countries and refugees, as we should, but we need to make sure we have the infrastructure to offer these new British Columbians effective healthcare, just like the existing British Columbians. And, the statistic 1 million British Columbians don't have a family physician, that's from a couple of years ago. And I would argue that number may be even greater now because I think, and I may not have the numbers exactly right, but I think as many as 500,000 people moved to BC last year. And so, we don't have the infrastructure to offer all of those new British Columbians a family physician. So, we need updated statistics. The government needs to be transparent and offer data to stakeholders and the public about really where are we at and what are the needs in the healthcare system and how are we spending our taxpayer dollars and how can we assure that we are achieving maximum efficiency of taxpayer healthcare dollars to deliver care to the most number of people possible.
I think you make an excellent point. We can't really solve a problem unless we can measure it and figure out where all those statistics are.
Yeah, and that's one thing that the public, if they are writing to their MLAs, they can be asking for increased transparency and that the government be forthcoming with data. They have the data. But even the physician groups, when they try to get access to the data, are not offered it, let alone the public. So, there needs to be sharing. We're all impacted by the healthcare crisis. Every one of us is going to be in need of healthcare at some point in time, whether we're a member of the public, we're a doctor or a nurse, or we're a politician. So this healthcare crisis interests us all, and it behooves us to be working together, sharing information, sharing data, so that we can come up with workable solutions and come up with those solutions quickly.
I agree. I think for some people, it's easy to forget about it until they need to access care. Mm-hmm. I think that's quite common just with how busy our lives are and how much the media affects a lot of thinking is you don't think it's a problem until you're in the ER waiting for 7 hours, right?
Mhm. And really, that's one of the things about family medicine is we are that area of medicine that you don't think about until you need it. And I think for too long, family doctors were taken for granted. People just assumed that they would always be there. But we are the point of access for people into the other layers of the healthcare system, to see a specialist or to get investigations in the hospital. And people don't necessarily realize what they're lacking until they come upon that healthcare crisis and suddenly they can't get access to the care. Whereas if we ensured everybody had a family physician, they would have guaranteed access to healthcare.
Right. And that kind of leads me into my next question. Can you help explain how having a longitudinal family physician is different from visiting a physician in the urgent primary care center?
For sure. There's multiple ways that is different. Uh, n- it's longitudinal versus episodic. So when you go to an urgent primary care center, you are going to see a different physician probably every time you go. So you're not going to get to benefit from the relationship aspect of having a family doctor, somebody who's known you over time, who remembers the fracture that you had when you were a teenager, who knows maybe, your parents' health because they also cared for your parents. And so they have that, genetic family history entrained in their thinking when they're considering you and your healthcare needs. Um, Urgent primary care center doctors don't get to know their patients, and they're not going to be able to deliver the same quality of care as somebody who's known you over time, who knows your healthcare issues and who really cares about you. A family physician goes home at the end of the day and they're still mulling through in their head, I wonder about this person, or I haven't seen this patient in a while because, I remember that they did have breast cancer and it just occurs to me that they haven't been in for their breast cancer checkup. I better get my staff to call them in. So there's that sort of whole person care. We care about our patients and their worries and their anxieties and their fears for the future. And that really can only be developed by knowing somebody over time. Preventative health care, screening for cancers, making sure, we counsel our teenagers about safe sex and, drug use and that sort of thing. Those are all things that will not happen when you go to an urgent primary care center and you're there for an episodic visit to treat one issue. It's only over time that we can develop that sort of preventative healthcare model, all encompassing, that thinks about you now, you in the past, your healthcare in the future. And so really the relationship aspect of longitudinal primary care is the missing factor with primary care when it's attempted to be delivered in other models like urgent primary care centers. The other side note I would make to that is urgent primary care center primary care is far more expensive and costly and less efficient with taxpayer healthcare dollars than family medicine delivered in a typical family physician's office.
Right. It sort of reminds me of the difference between sick care and health care, right?
Mhm.
We're a bit more preventative and holistic when you have the longitudinal model versus just episodic. So you're like, oh, something's wrong. I need to go see someone.
Mm.
But I think you make an excellent point that that ongoing continuous care can really help improve outcomes for patients.
Absolutely. Having a conversation, for example, with my 20-year-old now about healthy lifestyles, and knowing that their father maybe just had an early heart attack. So counseling them about a heart healthy lifestyle early on, and then remembering to screen their cholesterol as they get older, might prevent the coronary artery disease that's then going to lead to an early heart attack for them. So, there's those sort of healthcare outcomes that you don't see immediately. But if you look at a population as a whole over time, it is clear that the preventative healthcare, effective primary care is integral to ensuring the health of a population long term.
And I think so many people have just sort of adapted to only seeking care when they feel like they need it and really missing out on a lot of that preventative
Mhm.
screening.
Yeah, too few people these days don't even really know what it is to have a family doctor. They think, they might not even realize what we're fighting for when we say that everybody deserves a family doctor because, for so long we've been in this crisis and some people, they've forgotten what it's like to have a family doctor. They think of a family doctor as the person you see at the walk-in clinic, and you don't know over time. So we need to remind people of the values of family medicine, effective primary care, and what it is we're really fighting for.
As many of our listeners know, almost 1 million BC residents are without a family physician. Are you able to speak to some of the consequences of not being attached to a family physician and some of the outcomes for these people?
It's wide-ranging and extensive. We are seeing healthcare conditions presenting much later than they should because primary care is preventative care, and people unfortunately are going without cancer screening, or they're not getting their mole checked until it's very obviously an advanced and invasive melanoma, for example, because they didn't have a family doctor to go to. And if their only alternative was lining up for 6 hours outside an urgent primary care center to get that mole checked, they're probably not going to bother. So preventative healthcare is critical, and that is accessed through primary care. And most people want to access primary care through the care of a family physician. We know that family physicians reduce ER admissions by 35%. Having a family physician reduces hospital admissions by 30%. It reduces specialist referrals by 17%. So the consequence, we see it in the news every day. Our ERs are overwhelmed and have unacceptable wait times. People can't get a bed in hospital because the beds are full. People are frustrated because they can't get in to see specialists for 9 or 12 or longer months. All of that could be improved by ensuring everybody had access to a primary care physician, because we would offload our emergency rooms, we would free up hospital beds, and specialists could get back to doing specialist care rather than having their practices tied up with people that they can't discharge back to a family physician because there is no family physician for that person.
So, from what you've described, it sounds like whether you have a family physician or not, this healthcare crisis affects everybody.
Oh, absolutely. Everybody's being impacted by it. And I think we're all very aware of it. We all know people who don't have family physicians, who can't get care. And even the ones who do have family physicians are having to wait longer than they should to get appointments with those family physicians. It is well known and evidence-based to say that family medicine is the foundation of a healthy and functional healthcare system. And the healthcare crisis we're in would be improved by improving and ensuring everybody in BC has access to a family physician.
And from your sort of experience with advocacy and working in this field, what are some suggestions you might have for listeners who are learning about this crisis, who really want to take action and do something about it?
I think, never underestimate the power that you as an individual and that the public at large can have. The government and the politicians, they are most swayed, I would say, by the voting public. And everybody can do something. Everybody being frustrated and saying, well, I don't have a family physician and this healthcare system is terrible. Well, we all know that, but it behooves us all then to do something, and we can all do something. Write a letter to your MLA, your elected representative, saying, that you have issues accessing healthcare, saying that you don't have a family physician and how unacceptable you find that. Support groups like BC Healthcare Matters, their advocacy work in 2022, I firmly believe we would not have the LFP model if it hadn't been for BC Healthcare Matters and the grassroots work of the public getting together and demanding better from the government. So we need to realize that the LFP was a great step forward, but we're not there yet. And we can't just dust our hands and say, okay, well, that's that taken care of. We need to continue to all work together to lobby our elected representatives for change, to demand that we get value for our healthcare dollars spent. Let's put more of our taxpayer dollars into delivering healthcare. Let's reduce, the bureaucratic and administrative inefficiencies in the system, direct more money to healthcare providers and less to administrative, departments. Demand accountability. We're all taxpayers. We all have the right to say we want to see our healthcare dollars being spent wisely and making sure that care is delivered to British Columbians as we all deserve. We're not getting the type of healthcare that we deserve as citizens of Canada. We're all proud of the Canada Healthcare Act, but we're not getting the kind of care that is, one that we should be proud of. And we can demand better of our government.
I agree. I think especially when you look at it over time, it's kind of like when you put a frog in water and then turn up the temperature, they don't notice it as much as if you were to throw them into a boiling pot of water. I feel like it's happened so slowly and progressed over many years that people have kind of got accustomed to it, I'd say.
Yeah, and there's a sense of futility. I think it's like, well, there's nothing we can do about it. But 2022 and the LFP model shows that there is something we can do about it, and the public as a whole has power to affect change. And so I would encourage people not to be discouraged and to continue to lobby and to demand better. I speak to physicians and friends and family that live around the world, and they're horrified to think that there's 1 million people in BC without a family physician. They can't imagine not having access to a family physician. And British Columbia really does deserve better.
I agree. And I appreciate you taking the time to chat with me today and really reach out to our listeners and give them some information and some perspective of what it's like, on the other side as a family physician and some of the action steps that we can take. So just to end things off, I'm curious to know what your hopes are for the future of medicine here in BC.
Well, I certainly remain optimistic. I was saying to you earlier that we've known this problem was coming for a while, and unfortunately, for a long time, nobody was talking about it. I think we are all well aware of the problems in the healthcare system now and the crisis that we find ourselves in. But the fact is that being aware of the problem is the first step to finding a solution. So now that everybody is aware that there's an issue, we've taken some baby steps towards a better system. We need to continue those efforts. And so I'm optimistic because people are now talking about the problems, which hopefully will lead to us finding solutions. We've talked today about some very achievable solutions. Let's, reduce paperwork so the family physicians we have can get back to caring for patients. Canadian physicians, they've looked at if we eliminated all unnecessary administrative work from Canadian family physicians, that would be the equivalent of over 55 million patient visits a year.
Wow, that's significant.
Is that not a stunning statistic? So let's get rid of the unnecessary paperwork so we can get back to caring for patients. Let's create and work with the government to create efficient and secure electronic medical record systems that communicate with each other. Let's recruit new family physicians to the province. Let's attract young medical students into family medicine by making family medicine sustainable. One way that we can do that also is to ensure that compensation is fair and to maybe think about offering physicians pension plans and paid sick time, other things that people in the labor force take for granted and are often quite shocked to hear that physicians don't have access to.
I was very shocked when you mentioned that to me as well.
So, there's achievable solutions. We just need to all work together to accomplish those. And so I figure, we're not going to have it tomorrow, but if we keep working at it and we don't get tired and we continue demanding excellence from our government, the day will come that we will once again have a healthcare system in BC that we can be proud of.
I really enjoy your vision and I believe in it as well. I think healthcare is such a multifaceted issue. There's no just simple quick fix for it. But I truly believe if we work together and we brainstorm and collaborate and we have strategic long-term planning, I really do feel like we can get ourselves out of the situation that we're in now and back to being one of the world's best healthcare systems.
I agree.
Wonderful. Well, thank you so much for your time today. I appreciated all of your insights. Thank you, Dr. Lush.
Thank you, Jenna. A pleasure.
Remember, together we can advocate for the healthcare that we all need. The content provided on Your Healthcare Matters is for informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical concerns. The opinions expressed by guests are their own and do not necessarily reflect the views of the podcast or host.